group. So now we should be actually. So if for those of you who are on our private Facebook group, I believe you now should be able to see us. I think that I did not click a button that I was supposed to click. So we now should be on YouTube, and we should be on the private Facebook group, and we should be on the MedEdits Facebook group. So I'm sorry if that was delayed. Whenever we have new technology, it always sort of takes a little bit of getting used to. So I apologize if there were glitches. Okay, so let me go back now to our questions that were posted. A list of schools in the USA with an MCAT score between 500 and 508. That's going to be tough, and you can look on our website for all of the data that exists for medical schools and their average MCAT scores. I can tell you that it depends on what type of medical school you're considering. If you are looking at MD granting medical schools, you're going to have a tough time finding schools with MCATs, the average MCATs that are that low. If you're looking at osteopathic medical schools, many osteopathic medical schools have average MCATs within that range. So it really kind of depends on what your goal is. It depends on what specific type of school you're looking at. It also depends on your state residency, because there are some state schools that have lower average MCATs for in-state applicants. And it also depends on your demographics, because there are certain demographics who will have lower or higher average MCAT score. So there are a lot of different variables here in terms of figuring out kind of where you fit in with regards to those averages. Okay. All right, let's see here. Okay. Jennifer asks, I have heard residency plays a big part in acceptances, and certain states are better than others. How is New Jersey? Great question, Jennifer. New Jersey is actually a great state, I think, to be from, not only because I'm from New Jersey, but because there are several medical schools there. You have UMDNJ, you have Newark, you have Cooper, and those schools do have a very high percentage of in-state applicants. We would have to look at the data specifically for those schools and to see, number one, what percentage of in-state applicants get interviews. So when we're advising our students, if we're looking at their in-state schools, we're looking at the percentage of students who apply from in-state, what percentage of those students are interviewed. And then we can then look at what percentage of those students who are interviewed actually get acceptances, and what percentage of the class is from in-state. So these are kind of the important data points when we're looking at state schools and we're helping students to decide, are you from a good state or are you not? And then we're also looking at the average MCATs, of course, for those in-state applicants. Those are often a little bit lower at the state schools than they might be for the out-of-state applicants, where things are a little bit more competitive. So, so these are all kind of the metrics that we're looking at when we're helping students to decide, if we like their state that they're from, and if that's going to help their chances of getting into medical school, or if we're not so thrilled with their state residency. And then, of course, that also impacts their medical school list overall and how many schools they're going to apply to. How comfortable are we with, in terms of their competitiveness for their state schools, and are they interested in their state schools? So these are all kind of the different questions that we ask, the different things that we factor in when we are assessing a student's state residency and we're looking at their competitiveness for those state schools. Okay, let me go back to the questions that were posted before. When does MCAT registration start for the second part of 2024? So we just had registration for the MCAT, I think through June. And then for the second part of 2024, I'm pretty sure opens in February. I'd have to look at the exact dates. I don't know that off the top of my head. Okay, how about the best place to find a list of schools in the USA with early assurance programs, not BSMD, Virginia asks. So early assurance programs, for those of you who don't know, are programs that you will apply to usually as a sophomore in college to get early assurance that you will be accepted to that medical school. It is not easy, honestly, to find a comprehensive list of those programs. And the reason is because more and more of them we find are popping up all the time. Now, the schools that tend to have those early assurance programs, and this doesn't include Icahn School of Medicine at Mount Sinai, which has FlexMed, which is probably the best known and the longest standing early assurance program. But many medical schools have early assurance programs with the specific undergraduate colleges that are affiliated with their medical school. So, for example, Tufts has an early assurance program. Dartmouth has an early assurance program. Northwestern, SUNY Upstate has one with several of the New York State schools. So it is not easy to find a comprehensive list because there are always new programs that we are discovering. You will be able to find a lot of these programs on our website. And we are working with students for a number of these programs right now. For all the ones I've mentioned, we are working with students. But it's if we could keep an up-to-date comprehensive list, we would. But again, it's that always seems to be changing, and more schools honestly seem to be adding these. And I think it's a way for the medical schools to sort of lock in their best undergraduates. And so I think that they're seeing the advantage of that. So, okay. If you have any more questions, you can go ahead and post them. I can see them here. Okay, and just for those of you, I'm just going to reintroduce myself since now we do have more people here. My name is Dr. Jessica Freedman. I am the chair and founder of MedEdits Medical Admissions. I've been in medical admissions my entire life. I am a physician. I was a medical educator, an instructor, a faculty member at the Icahn School of Medicine at Mount Sinai, where I also was on the admissions committee. And since founding MedEdits more than 15 years ago, I've compiled a team of experts, all of whom have admissions experience. We hold our faculty to very, very high standards. We don't hire medical students with no experience. Everybody has served on admissions committees, and we're independent. We're not run by investors like the majority of my competitors, and that really sets us apart. Nearly all of my competitors at this point are run by business people or run by people who are not in medicine. So it's something to think about. Okay, let's go ahead. Let's answer some more questions. Okay, can you discuss when students should write a letter of interest and a letter of intent? Great question, Rahana. So let me first explain what a letter of interest and a letter of intent, what those are. A letter of interest is a letter that you write to medical schools before you've been granted an interview expressing your specific interest in the medical school. And you do this to hopefully get a little bit of attention, to hopefully flag your application. So if you haven't yet gotten an interview, they will see this letter. They'll see your, what you've done, why you're interested in the school. And maybe that will motivate them to invite you for an interview. In our experience, letters of interest do not tend to result in more interviews all that readily. So while it is not a negative, it certainly can't hurt you to send a letter of interest, we don't find it actually helps all that often. You should be writing a letter of interest only if you have really significant updates for the medical school, number one, and if the medical school will accept a letter of interest. Not all medical schools are going to accept additional communication. So you want to follow the rules that the medical school has in place. Now, a letter of intent is a letter that you write similar to a letter of interest, but it happens after you interview at the medical school. And you write that when you want to express to the medical school, you are my number one choice. If I'm accepted to your medical school, I will most definitely attend. It is a little bit early to be sending letters of intent. Sometimes this early in the process, it can seem a little bit desperate. It might also kind of seem a little bit, uninformed because it is so early in the cycle and you've just started, and, how much do you really know about what you want in your medical school, in your medical education? The only time when we might advise that a student write a letter of intent this early is if there sort of is a special circumstance that really, kind of makes it clear this is definitely where I want to attend. Maybe you already live there. Maybe you have family in that area. Maybe you've been doing research at that institution, for a long time. So you really are justified in saying, in saying, I definitely want to go to this medical school. But generally speaking, we don't encourage that students send letters of intent, certainly until after the new year. And you can send a letter of intent before you get a decision. But again, we discourage students from doing that this early in the process. That's something that we might advise a little bit later in the process, certainly after the new year into the spring, depending on what other offers the student may have at that point. Okay. Does a bachelor's in kinesiology, is that considered one of the best options for pre-med courses, or is public health better? No major for pre-med is better or worse. The best major is the one that you are the most interested in, the one that you are genuinely passionate about, the one that will give you the most opportunities to show your academic excellence, to get experience in research, and to explore what you really want to study as an undergraduate. If you actually look at the undergraduate majors and who has the highest MCAT scores and who does best in the process, interestingly, it's humanities majors. There might be there are different reasons potentially. Nobody really knows exactly why. I have my own theories, but the most common major for medical school applicants and medical school matriculants, are the biological sciences. But there really is no major that is better or worse. So, of course, a major in kinesiology, public health, that lends itself to some really terrific research, potentially some really terrific hands-on experiences that would be important to medical school admissions committees. But you can major in anything. So you choose the thing that you really want to explore more as an undergraduate, keeping in mind that once you are, studying in medical school, you're not going to be able to study those non-science disciplines as easily. So sometimes undergrad can actually be the last chance that you have to really explore something that isn't related to the sciences very, very deeply. Okay, let me see what other questions here. Just taking a look through. I heard that if you applied in October or late September, then chances of getting interviews are very less, regardless of your score. Is this correct? Yes. If you are applying in late October, when we have students who call us, let's say next week, and they say, I have a 520 on the MCAT. I've got a 4.0. I have great research. I was busy and I was late in applying. We tell them, don't bother, wait until next year, because the chances of being successful in this process, even if you are a stellar applicant, is just going to be so much lower when you are submitting a late application. Now, if you really, let's say have a perfect MCAT score, a perfect GPA, you've been doing thousands and thousands of hours of research at a top medical school, and they're going to interview you. I mean, there may be specific circumstances where we say, okay, maybe you can apply and maybe you'll be successful, but that is really, really rare. So when we're getting into the fall, even into the late summer, and we have students who say, I've been dragging my feet, but I still really want to apply, we're recommending to those students that they wait and that they submit an early application. We see so much, students are so much more successful when they submit early applications. And, already a very large percentage of our students already have acceptances. And that's to both MD schools, all kinds of schools all around the country. And that's osteopathic schools as well. At this point, most of our students, I don't know if it's all of our students. I need to look at sort of where everybody is, but I'd say nearly all of our students at this point have interviews. So you're really kind of at a huge, huge disadvantage when you're applying late. It makes it so much tougher. So I know that maybe isn't what you want to hear, but it's important to hear. Okay, Let me see. Okay, please can you explain the process of Canadian medical school for a Canadian medical school interview? My son is a Canadian, has a GPA of 3.99, MCAT of 519, more than 1,000 hours of research. Mohan, that sounds like a competitive applicant. 519, 399 GPA, thousands of hours of research. I would expect a student with those types of numbers and those stats. I would expect that student to definitely receive interviews. So if the student does not have interviews, then this is something that we would want to see their application. We would want to understand the nuances of that application. Why doesn't the student have interviews? Because that doesn't sound right to me. When do they start calling for interviews for BSMD? Well, BSMD applications are not even due until November 1st at the earliest. So those interviews are not going to be happening until the winter. Okay. All right. So Virginia asks, what is the best place to find a list of U.S. schools offering early assurance programs? Right. So, Virginia, I answered this question earlier, but I'll go ahead and I'll answer it again. There are more and more early assurance programs that accept students as sophomores in college. There are more and more of these that are popping up every year. The majority of them we find are school-specific programs where the university has a medical school that's affiliated with the university. So Dartmouth, Northwestern, Tufts, those are just a few. And they are trying to get their best students and trying to get those top students to commit to them, as at the end of sophomore year, going into junior year. Of course, probably one of the best known early assurance programs is the Icahn School of Medicine at Mount Sinai. But we are learning of more and more early assurance programs every year. We find that there are more of these are popping up, and more universities, more medical schools are adding them. So I expect that trend to continue because it's something we've been following, but I don't know of a comprehensive resource. Probably the MSAR, the medical school admissions requirements, you can see if a medical school has BSMD applicants, but right now there is not any sort of centralized database that lists all of the acceptances that are coming from early assurance programs. That actually would be a great thing to add, I think, to the MSAR, as more and more medical schools are adding these. There also is, excuse me, there's also, there's several New York universities that link to Upstate that allow early assurance there as well. So but we don't know of any centralized database. If you find one, let us know. You can also look on our website. We do have a lot of them listed, certainly. Are there any free MCAT resources? Khan Academy, great free MCAT resources. And I think the Association of American Medical Colleges, those are not free resources, but they're not all that expensive. So they're not going to be as expensive as, like Kaplan, as Princeton Review. But people like Khan Academy, certainly. And then there are some, inexpensive resources as well, like question banks and things of that nature. Okay. Brigido asks, are there a list of schools that take letters of interest? No, there really aren't. But your student can always go onto their portal. So, as some of you may know, when you apply to medical school, you get a portal. And the portal is going to tell you which of your materials are in, have you satisfied all their requirements? And then it's going to tell you what you can do to potentially update the medical school if the school allows updates. It should tell you that explicitly in the portal. So if your student isn't sure whether or not their school that they're interested in will accept update letters, then they should go ahead and they should go into their portal. They should check that out. They should be able to find that information there. Someone asked, does Wayne State take letters of interest? I don't know if they specifically take letters of interest. But and don't be afraid to call the medical schools as well. We have students who, they some, obviously there's so many medical schools in the country that it's impossible to know the answers to all these questions when we're talking about specific institutions. If you have a question, just call the medical school directly and ask them. They're human beings. They know this is a tough process. So don't be afraid to just pick up the phone. Hi, I'm really interested in your medical school. I really like Wayne State a lot, and I want to send a letter of interest. Is there a way for me to send a letter of interest? Do you accept those letters? Just, again, authenticity and honesty in this process will get you a long, long way. Okay. Can you please give a roadmap to med school admissions starting from college? That's a tall order. Okay, I'm gonna go over some very, very basic fundamentals. First of all, most students, when they're going to med school from college, there's typically the 4-year plan, meaning you're applying at the end of junior year of college, and you are applying during your senior year of college. You are then matriculating immediately after graduation. The larger percentage of students now are taking gap years, meaning that the majority of them are taking their MCAT the summer after junior year. They are applying at the end of senior year, right around graduation time, and they are then taking a gap year to bolster their experience, to bolster their maturity, to have a more interesting candidacy, and they are then applying during the gap year, and they are matriculating 5 years after starting college. During this process, you need all your prerequisites. You need to prep for the MCAT and take the MCAT, and you need to gain the valuable experiences that are going to make you a competitive medical school applicant. What experiences you obtain during your undergraduate career, during your gap year or your gap years, is going to depend on what kind of medical school you want to get into, how competitive you want to, where you want to be aiming, what is your ultimate goal. And it's going to depend on your interests largely, and sort of, where you want to try and excel in your undergraduate extracurricular experiences. And there's a lot of exploration that goes on during undergrad. Students should not be starting undergrad knowing exactly what they're going to be doing. A lot of this, it sort of evolves over the course of time. And that's often how the interests become more genuine and more authentic. I talk about authenticity a lot, but I can't sort of emphasize enough how important that is. You don't want to be checking boxes as much as possible in this process. Okay. Is working at a hospital and as a transporter, taking patients around the hospital to different appointments with a good job for med school applications? I actually think that's a great job because transporters are so important in hospital operations. And I think that gives you a window into understanding different departments in the hospital, understanding how different, the different collaborations that are going on. You're going to get a really good understanding of the different departments in the hospital, the different types of patient experiences, the different types of patients. And it also allows for sort of these informal conversations between the transporter and the patient, between the transporter and the nurse or the doctor or the family member. And so I actually think that's, if that's an option, I think that's in fact a great way to get an experience that's really fairly unusual for a pre-med. And I think you can get a lot out of that. Can we do a letter of interest for BSMD too? No, the BSMD process is a bit different. I've never heard of students writing a letter of interest for BSMD. Certainly letters of intent, I think they're called letters of interest in the college game. Actually, those can be written if you're waitlisted, and you can express that the school is your number one choice, and if you're accepted, you'll get in. We don't hear of many BSMD applicants getting waitlisted, but there are some. I mean, it does happen. So you might write a letter of interest if you're waitlisted, but certainly not beforehand. It's a bit of a different process. Is it better to upload a letter of interest to the portal or to send it to the school admissions office? It depends on what the school prefers. And this is why we encourage every student to follow the individual school's guidelines. If they have a question about that, if it's not clear from what is explained on the portal, they should be calling the medical school admissions office, and they should be asking specifically, I want to send an update letter. I want to send a letter of interest. Where should I be sending that? So go right to the source. Again, don't be afraid to call people and just, kind of seek out that information and be resourceful. And that's what we all want in our medical students. We want them to be resourceful and to get the answers themselves. So that can really help you. Okay, I think that we have answered all the questions tonight. And this seemed to work well. So I am so happy about that. I thank you all so much for tuning in. And we will see you next Thursday night back here again. Again, you can find us on Thursday nights now on either our main Facebook page, our private Facebook group. If you don't belong to our private Facebook group, please join. And or you can find us on YouTube. So we're now going to be streaming these on YouTube so we can reach a broader audience. And so I hope that allows everyone to take advantage of our knowledge. And congratulations also to all of our medical school applicants. Again, we have an amazing list of interviews, of acceptances already. And we're just so proud of our students. They've done so well this year. And we are also super proud of our residency applicants, most of whom have interviews at this point. I think, the residency has changed recently in terms of the process. It's going to change again next year, we think, in terms of the application system we're anticipating. So our residency applicants are also doing really well in the residency application process, getting interviews, starting to go on those interviews. So thank you again for being here. I hope to see you all next week. Have a wonderful, wonderful weekend and a great week. And I'll see you all soon. Bye-bye.